During today's video, we're going to discuss your menstrual cycles. One of the most common questions that I get asked as an OBGYN is, how do I know if my menstrual cycles are normal? Are they too heavy? Are they too light? Well, we're going to break that down today into 5 key questions that will help you determine if your cycles are indeed normal. Hello everyone, I'm Dr. Layla Townsend, board certified OBGYN, and welcome to my channel where we discuss all things women's health. So ladies, let's get out some pen and paper and let's get to know your menstrual cycle. But before we get started, please hit that subscribe button, as I would love to have you join this community, as well as hit that little bell so that you will be notified every time we release a new video. So let's get started. Beginning with number 1, how often should you be having a menstrual cycle? Well, this is a 3-part answer where I will briefly talk about what is considered normal for our teen girls, our women between the ages of 20 to 45, and our lovely ladies from the age of 46 and above. And just a quick note, when it comes to calculating your cycle length, you count starting from the first day of your menstrual bleed. That will be day number 1. And you will continue to count every day thereafter until you hit the first day of your following period. And that will give you your number. So let's look at our teens. Now with our teen girls, what is considered normal is having a period once every 21 to 45 days. It's not uncommon for this age group to have unpredictable cycles as their bodies are maturing and their hormones, they're dancing around trying to find their own normal rhythm. So that's why it's important that teens keep track of their cycles. With that being said, it's important that your pediatrician, gynecologist, or other medical provider be aware of any menstrual pattern changes, because there are other medical conditions that can actually sneak in around this time whose symptoms closely resemble that of a normal teen whose cycles are inconsistent, ranging from polycystic ovarian syndrome, endometriosis, and teen pregnancy, to name a few. Moving on to our beautiful women ages 20 to 45. What is considered normal in this age group is having a period once every 21 to 35 days. I know that many of you may be used to hearing us talk about the average woman having a cycle once every 28 days, and she ovulates on day number 14. Well, as women, we have different bodies. Of different bodies come different types of menstrual cycles. If you fall out of those parameters of having a period once every 21 to 35 days, that could be due to one or a combination of things, ranging from pregnancy to the type of birth control you are on, polycystic ovarian syndrome, or some other medical condition. So that is why it's important that you keep track and notify your medical provider if there are any changes whatsoever. For our lovely ladies 46 and above, as we are transitioning into another great stage of our lives, our cycles are expected to transition as well, and can be quite unpredictable for many of us. They can become shorter, they can become longer, heavier, or lighter to the point that they disappear. This is the time period that we call the perimenopause or perimenopausal menopausal transition. Again, it is very important that you also keep track and report any changes to your medical provider as well, because this is a time where other medical conditions such as thyroid issues, stress, fibroids, polyps, precancer, and cancer can impact our cycles. And just for the record, ladies, it is only considered true menopause when you have been 12 full months without a cycle. Not 11 and a half, but 12. If you begin to experience bleeding after being without a menstrual cycle for 12 months, that's what we call postmenopausal bleeding, and that is considered abnormal. Moving on to number 2. How many days should you be bleeding? What is considered normal is bleeding anywhere from 2 to 7 days. The average woman bleeds 3 to 5, but 2 to 7 is perfectly normal. Now, what should make you contact your medical provider is if you bleed more than 7 days, if you bleed less than 2 days, if you have bleeding during sex, we call that postcoital bleeding, if you have bleeding in between periods, if you begin to skip your monthly periods, if your periods begin to change, meaning that if you're used to having a period where you bleed 2 to 3 days a month, and then all of a sudden now you're bleeding 7-day cycles, If you begin to have pain with your periods, or if your periods disappear completely, you must contact your doctor. Now, moving on to number 3, what should you visually see when you are menstruating? Well, this is a two-part answer because we need to look at two things: consistency and color. With consistency, your period should be mostly fluid-like. Sometimes you may pass small clots here and there, and should be the size less than a dime. Okay, that's 1.8 centimeters. Or passing more clots, like small clots, but more frequently, or if you are passing large clots the size of a quarter or bigger than a golf ball, you should contact your provider. Now, when looking at the color of your period bleed, it could range anywhere from a light to a bright red to a dark brown, almost black color. Now, when I see the darker colors, it usually means the end of someone's cycle because menstrual blood starts to slow down as it makes its exit out of the vagina, and blood contains iron. And as it hits the air, it oxidizes, and that's what gives it that dark color. Now, moving on to number 4. How much menstrual bleeding are you doing? I'm going to show you a very simple technique to help you calculate, but first let's go over to my classroom. Hi ladies, I'm down here. Okay, what I'm showing you here is what is considered the normal amount of blood that you should have during your menstrual cycle. And that could range anywhere from 30 to 80 milliliters of menstrual blood. That is the equivalent of 2 to 5 tablespoons. So what I did here is I divided the women up into light, medium, and heavy. Again, they're all considered normal, falling within a normal range, but I just wanted to give you an idea of what is considered the lighter side of normal, what is the medium side of normal, and what is the heavier side of normal. With our light being 30 milliliters, equivalent to 2 tablespoons, our medium being 50 milliliters, equivalent to 3 tablespoons. And then on the heavier but normal side, that's 80 milliliters, that's 5 tablespoons. Again, if you fall within this range, you're considered normal. My only caveat is this: if you're a woman who's used to being on the lighter side of normal, and all of a sudden you're jumping over to the heavier side of normal, you need to notify your provider, okay? All right. Knowing that losing anywhere from 30 to 80 milliliters of blood, which is the equivalent of 2 to 5 tablespoons, is considered normal, let's see how much blood you are losing by calculating how many pads or tampons you are using. Now, if you're using menstrual cups, that's even better because there are little numbers written on the side. So, if you compare a regular tampon or pad to a super tampon or pad, you will see that a regular size can hold up to 5 milliliters of menstrual blood fully soaked, that's a half tablespoon. And a super size can hold up to 10 milliliters, that's the equivalent of 1 tablespoon. Now, breaking that down even further, if we use the examples of my light, medium, and heavier flow ladies discussed earlier, you could easily estimate how many pads or tampons they would go through. For example, if you bleed approximately 30 milliliters, and that's 2 tablespoons, you would go through 6 regular tampons or pads fully soaked, or 3 supersize fully soaked. If you change them out when they're partially soaked, just divide the number by 2. If you bleed approximately 50 milliliters, and that's 3 tablespoons of blood, you would go through 10 regular pads or tampons, or 5 supersize. And if you bleed 80 milliliters of blood, and that's 5 tablespoons, you will go through 16 regular pads or tampons, or 8 supersize. Now, I will say this, that some of you ladies may be uncomfortable with this because you may think that you may be underestimating or overestimating the amount of blood you lose. But please don't panic. Our cardinal rule as medical providers is if you say it's too heavy or too light for you where you are uncomfortable, that's all we need to hear and we will figure it out. But what I will tell you is that if you are bleeding so much that you are changing tampons or pads every 1 to 2 hours, or you are waking up all throughout the night having to change tampons, pads, bed sheets, or you're lightheaded, always tired, dizzy, or if you can't even climb a flight of stairs without feeling short of breath with your heart racing like it's going to burst out of your chest, you need to be evaluated immediately. Would it surprise you, ladies, to know that what is considered normal during one's period is either having no pain or at most menstrual cramps, which we call primary dysmenorrhea in the medical world? It would be the kind of cramps where you experience discomfort in the front of your pelvis and in the lower back. At most, you would need a heating pad or ibuprofen, and you would continue on with your daily lives. I mean, you really wouldn't even skip a beat. Now, anything beyond that is not normal. If you are a woman who's writhing around complaining of stabbing, burning, gut wrenching pain, you can't function to the point where you miss school or work, then that is not considered normal. Typically, when we see this, we evaluate for such conditions as endometriosis, adenomyosis, fibroids, and infections, just to name a few. So by no means, in my experience in the past 20 years, have I considered that just normal period pain. So with that being said, it isn't just a period. Your period can actually give us medical providers a window into your overall health. And what I mean by that is that how your period behaves can tip us medical providers off, letting us know that you may have, let's say, vitamin mineral deficiencies, thyroid issues, liver issues, blood clotting issues, mental health issues, or even issues placing you at risk for cancer. In essence, ladies, 9 times out of 10, your periods will always tell on you. I promise you that. So if you like this content, please comment below and don't forget to click the like and subscribe button as well as the little bell icon so that you will be notified every time I release a new video. Bye.